Hello everyone, my name is Kelly and I currently work as a patient care technician at Mid-Michigan Health, Gratiot Campus in Elma, Michigan. I knew right away I wanted to volunteer at the same place that I worked, but only with the therapy department. Some might not think this is a service to others or to my community, but it's a different kind of learning service that I will be doing as a career. Our facility offers physical, occupational, and speech language therapies. I focused on the physical aspect as this pertains to the career path I have chosen. As a physical therapist, oftentimes a second hand is needed to help do an exercise. When a patient comes into our unit, they will need assessed as to how they can transfer, like walking or even moving from the bed to a wheelchair. If this person has an extensive injury, it might take two people to help them do this. I also helped push a patient's wheelchair when the therapist was helping them walk. I assisted in simple exercises that helped with motor skills. A gentleman that came to the unit the night before had had a stroke and was really weak on his left side. So the therapist had him try to walk with the parallel bars, and I had the wheelchair ready and would make sure he didn't sit on his oxygen tubing. He would get tired just after a few steps. I also played cards, watched a movie, helped put a puzzle together, but just sitting and having a conversation was by far the best activity I did, and many patients were thankful that I spent the time with them. There are two disciplines I chose to explain that are related to social science. The first is sociology. Sociology relates to therapy because so many patients have a life-altering event that changes their life, and some events can cause impulsive behaviors, especially with a stroke and brain injuries. This change not only affects the patient, but the family as well. Family members might have to help take care of their loved one, and that can be a big change and often frustrating as a patient has lost or partially lost their independence. Injuries or life-changing events can also be difficult in society. Where walking and talking used to occur, having to use an assistive device like a wheelchair or a walker can make running errands or shopping difficult. Going to places that are not equipped for assisted devices can be frustrating as well. Or just having to depend on someone else to do these things makes life harder. Psychology plays a big role with therapy also. So many emotions and feelings result from an injury like strokes, brain injuries, respiratory issues, heart problems, and even car accidents. Depression and anxiety are two most common issues related to health and healing. Many patients do not realize these emotions, especially those with brain injuries. They become impulsive and often do not realize what they are doing. Depression also sets in. Patients become hopeless, negative, and not want to talk or participate in daily activities to improve their situation. This is where visiting or just being present is very important, especially those that do not have many visitors. What I learned about volunteering my time on our unit is how important these patients are, and even more so, making them feel positive about their situation. Being a part of the recovery is so rewarding, and to know that these patients are truly thankful for what the therapists do. It is not an easy job because you have to be a bit pushy to get patients to understand some of these exercises. And 3 hours a day is spent with each patient, and that is a lot of time to get to know them and to listen to them and to understand their physical and emotional struggles. Therapists must have so much compassion to do what they do every day. Seeing a patient come into the unit unable to walk or talk, or whatever the case may be, and then a few weeks later see that same person walk out of our unit waving or saying goodbye is such an amazing feeling. Patients are always so grateful to the therapist and to all the staff. In just a short time, these patients have become lifelong friends. As a therapy patient myself, I know firsthand what great things these therapists have to do to help patients regain not only their physical movement back, but also their emotional state of mind to continue to improve and become stronger and gain some or all of the independence they had lost. I love working with people. Some people would say I try to fix things. I'm a fixer. Yes, that's right. I want to help fix those that are broken. I've seen many stroke victims and brain injured people, and these are the types of people I really want to help. Also, I think working with veterans would be a wonderful way to give back to them for what they have done for themselves, their family, their community, and our country.